Good morning, good afternoon, and good evening, wherever you are tuning in from. My name is Dr. Temo Waqanivalu, and I work for the Non-Communicable Disease Department here in WHO headquarters. We are on this series on delivering NCD services, and I'm starting today with talking to you about the challenge, the demand, and the support that is to be provided. Now, the NCD burden, I don't need to talk to you any further on it, because if you see this graph, it talks about the burden of non-communicable disease as far as premature mortality is concerned. I'm from Fiji, and so when you look at this graph, you will see that if you are born in my country, your risk of actually dying from a major non-communicable disease between the ages of 30 to 70 is 31% compared to Japan or Republic of Korea, where it is 8%. So the inequity that defines NCD is something that we all know. Now, in terms of the services that are provided to cater for non-communicable disease, you will see here in the Primary Healthcare on the Road to UHC 2019 monitoring report that there were rapid improvements in the coverage of infectious diseases in UHC packages since 2000. But very relatively little change on NCD, except for some developed countries who have worked hard on cardiovascular diseases. This has been rather a flat line. Now, when you move from that lag and that challenge to this period of COVID-19, if anything, it has exemplified, it's given an X-ray on the whole NCD services. It's negatively impacting people living with or affected by NCD, something we've called the deadly interplay between COVID-19 or any outbreak for that matter, because those living with non-communicable diseases are the most vulnerable in this situation. Dr. Tedros put it very correctly, that COVID-19 has sprayed on people with non-communicable disease. So what are the governments and the member states of WHO demanding for? When we took this for 2020-2021, the most requested technical support from member states is to integrate NCDs into primary health care and UHC. So the demand is there for support from us who are ready to offer it. Now, what does that actually mean? In a work on a global good that's done here at WHO of integration of NCD into National Communicable Disease Program or health system, the definition of integration of health services has come up. And I would like to recite it here. It's the organization and management of health services so that people get the care they need. It's not about the programs, but it is about people getting the comprehensive care that they need in the continuum of NCD services. And that's what the member states are actually asking for. And so how do we do that? How can we provide that support? In the same work that we are doing on the global good, there's three areas that come out as being critical in here. Strengthening upstream policy initiative, as such as strategic planning and resource allocation, benefit package and payment system. The service providers needs to be engaged. This is absolutely important. And then the human resource and capacity interventions. And in this strategic guidance, we have 26 evidence-based strategic actions that you can actually look at. Now, how do we do and what sort of support is provided? If you look at the 6 building blocks of health system, in governance, we need to get non-communicable disease in the National Health Sector Plan. Integration needs to be part of the policy discussion. Investment cases done well in actually advocating for investment in NCD, but that needs to be followed by non-communicable disease services being defined and prioritized in UHC benefit package. And we need to leverage domestic financing for this. In the medicines and technology, there is huge effort to try and make medicines and technology for NCD accessible. And then the workforce is an absolute critical part that we need to work on to strengthen, train, but also do workforce planning to be able to then deliver the integrated chronic care that we're looking at. And health information is one that straddles across these areas. So these are possible areas for action, but just be aware that these don't exist in a linear fashion. As you know, these are all interrelated domains that you need to work on. So it's shown in this schema how these are actually all integrated, but be aware that the community and the people are central to this, as we've defined there in the integration of health services. Absolutely focused and centered on that individual that walks into your primary health care. That's where the actual action begins. Strengthen the system to be able to ultimately deliver on these areas. And they are interrelated. Be aware that there's a culture, that there's a political context, and technology really that you need to have us in delivering these services. And so comes down to the question, what can you do? What can I do? 3 areas: advocate, act, and influence. For those of you who are maybe at the lower level of the system, advocating for system strengthening efforts to deliver NCD is absolutely a key action in any of those areas I've described. But if you are at the level where you can act, why not take the step, do something now? You know, an improvement in one part of the system affects the whole, just so you know, as I've shown in the schema before. But if you are really at a point of decision making, then I'm encouraging you, seeing the challenge, seeing the burden there is, seeing the demand from member states, it's time for you to take some action, impact some decision in order to help NCD services be delivered better and so that people can get the comprehensive care they need. If you need more information, do contact us. Address is down below, but there's also a further series that's going to be done as we dive deeper into each of the health system building block. So from WHO NCD Department, thank you for your attention and watch out for the next one that is coming your way. Thank you very much.